Hi, this is Deirdre O'Connor, Associate Director of NCCD, and I'm going to spend a few minutes talking with you about pay for success opportunities within tribal communities. NCCD is an awardee of CNCS Social Innovation Fund. Through this award, we've been able to explore pay for success feasibility assessment opportunities in tribal communities. To provide a little bit of background information, there are 567 federally recognized tribes and many more that are trying to achieve federal recognition. There are 326 Indian reservations, and there are 5.4 million people, or 2% of the population, that identify as Alaska Native American Indian. The vast majority of those live in urban communities or suburban communities or rural communities across the country. Just 22% of the Alaska Native American Indian individuals live on reservation. NCCD has been exploring pay for success opportunities with tribes and tribal organizations because of, particularly in child welfare and juvenile justice. We've been exploring these opportunities particularly because of the high rates at which Alaska Native and American Indian families become involved with these two systems, and the negative outcomes that are seen by children and families who enter into foster care and or are detained in the juvenile justice system. As we've explored these opportunities, we've also identified that there are significant other negative outcomes experienced at higher rates than than across the country in areas of education, health, mental health, adult justice, and housing. In education, American Indian and Alaska Natives as a group have lower rates of high school graduation, college enrollment, and graduate degree attainment than any other group. We also see that in health, they have substantially higher rates of disease, including a 600% higher rate of tuberculosis. Alcoholism they experience at 500% higher rates than the population in general. They have diabetes at 200% the higher rates. So there are a significant number of health outcomes where there's a great deal of opportunity to improve the experience of the Alaska Native and Native American populations. The same can be true for mental health. Suicide is recognized as a significant problem on reservations and in tribal communities across the country. They frequently experience clusters of suicide that impact every single member of their community and have this huge impact on other short-term and long-term well-being outcomes for folks who live in those communities. Criminal justice, similar to juvenile justice, the Alaska Native and Native American populations are overrepresented and experience harsher outcomes from those who do become involved. And in housing, particularly on reservation, the state of the housing stock and the availability of adequate housing is a recognized problem. So in all of these areas, there are opportunities for increased resources to improve short-term, mid-term, and long-term outcomes that would likely lead to reduced cost savings over the long run. As NCCD engaged with tribal leaders and leaders of tribal organizations around the possibility of exploring a pay for success feasibility assessment, several clear themes emerged in terms of challenges to pursuing these activities. One is capacity and scale, particularly when talking with service providers from reservations. There was a immediate concern identified in terms of the size of the population. Most reservations are relatively small and relatively isolated, and the target populations within any given service intervention would be even smaller. Another concern that was immediately identified is the resources needed to complete the feasibility assessment and to engage in a pay-for-success transaction, particularly around data infrastructure. Very few of the service providers on reservation have the data infrastructure needed to complete the rigorous data analytics within the feasibility assessment projects. There's also concern, they also are significantly concerned about the ability to monitor fidelity to intervention and to measure outcomes given existing data infrastructure. A third challenge that was identified is the concept of delivering a proven intervention or an evidence-based intervention. Many tribal organizations and service providers on reservation are interested in providing an intervention that meets the needs of their community. And even when these interventions have a demonstrated impact within their community, they rarely have been rigorously evaluated, particularly through experimental designs. So these type of interventions could be funded through a pay-for-success transaction within a knowledge-building capacity. However, it would be a different kind of transaction than one that is scaling or implementing a proven intervention in a new community. The biggest challenge to continuing these conversations, however, is really the issue of trust. There's an unfortunately long history of engaging in partnerships with tribes and then the tribes not receiving what they believe they have been promised. And with the pay-for-success transactions requiring a trusted as well as a contractual relationship, building that trust is an element that would need to be accomplished through the pre-feasibility, feasibility assessment, and transaction building process. If you'd like to hear more about the work that we've done in exploring this, the very preliminary work that we've done in exploring this, please feel free to reach out to me. My phone number is 301-233-5395, or you can email me at doconnor@nccdglobal.org. And again, thanks for listening.